are on tonight with the amazing Dr. Ellen Hendrickson. The show's focus is around mental health and making sure that mental health information gets to everyone and anyone. We do so through expert interviews, through conversations with people with lived experience, through open discussions, and through an amazing community, which you are now part of by viewing. So thank you so much, everybody who's here. I appreciate you. And thank you so much, Dr. Hendrickson, for being here.
Absolutely. I'm delighted to be here. Hello.
So Dr. Hendrickson is a clinical psychologist who has a focus on anxiety and being authentic. She recently wrote a book, which is fantastic. And I was kind of giving everybody the 25 steps that 25 things that could let you know that maybe you have a little bit of social anxiety. So the book is called How to Be Yourself, or How to Be Yourself, Quiet Your Inner Critic, and Rise Above Social Anxiety. So I found Dr. Hendrickson through her tenure as the original host for Savvy Psychologist, which I highly recommend. You can go back and listen to any episode. They're just great tips on every and any topic. So you really can't go wrong. But yeah, I absolutely adore Dr. Hendrickson. And when she replied with, "Hey, maybe I'll come on," I literally ran across the house screaming to my husband. So this is going to be awesome. I'm super, super excited for everybody who's here, because you will have the opportunity to ask questions to a very amazing scholar in this area. So, okay, that all being said, Dr. Hendrickson, hi.
Hi. And you can call me Ellen.
Okay.
Yeah.
Okay.
Yes.
Ellen.
No worries.
Okay. I'll totally.
I hope this screaming and running was positive screaming.
Oh,
and
it was
running.
yes. It was the most positive thing.
I never know.
Because I was like, well, I'm gonna shoot my shot and invite people I really admire, and we'll see how it goes. And I sent it, and you were the first email I sent. And when I got a yes, it was like, oh, was it really okay? Yeah. So it was really cool. So thank you.
Cool. I'm honored.
Thank you. Volume up on guest. Let's do that. Let's make sure we do that. Okay.
Better?
Okay. Up.
It's like the optometrist. Better one, better two.
Yeah, better one or better
Right.
two. Okay. I think we're good. You sound good to me. I can maybe quiet myself, so that'll help out with volume levels too. Okay. All right. So yeah, if you can I know I kind of gave your background already, but if you can kind of dive deeper and tell us more about yourself and why you studied what you study and all that.
Sure. Yeah, no. So I am a clinical psychologist. I work at an anxiety specialty center in Boston, and that's a couple days a week. And then the rest of the time, I am a writer and an author, and I love the mission that your show has, which is like making mental health available to everybody and anybody, because that is exactly my mission too, and why I did the podcast and why I wrote How to Be Yourself, because I sit like at a university, or like that's been my career and my training, and like just too many ivory towers, and it gets really siloed, and so like there's all this great research or like fantastic service going on that needs to be disseminated, that really needs to be available to everybody. And so I really see that as my job, as to make mental health care, like really like good scientifically based mental health care, as available as possible to everyone, because it's so important. And so I did that through the podcast and the book and talking to as many people as I can. So so anxiety is my specialty, but social anxiety is my super specialty. So that is, and I could talk about that for days. So watch out.
Well, we need you to talk about it for days. So you're all good
in
here.
the right place.
Yeah,
okay,
you're
good.
Definitely in the right place.
Awesome.
And that also speaks, that also kind of further speaks to what we're trying to do here. I originally started out as just saying that like I wanted to be the bridge. When I was looking for help, I felt like there were either people talking about their personal experience, or there were doctors talking about it in a very clinical and dry manner. And I was like, if we could marry the two, so we can get the personal experience, but we can also talk about it from a scientific perspective, that would be awesome. And that is the reason why I love Savvy Psychologist, because when I found it, I was like, oh, they tell you the things in 5 minutes or less. Anyway, yeah. So I told you.
I aspire to be a bridge. Yes.
Yeah, it was perfect. And I have to say, the community probably doesn't know, but I've definitely talked about stuff that I learned through the podcast and then
Oh,
carried
cool.
into the show and been like, we're gonna
Pass
talk
it
about
on.
yeah,
Pass it on.
exactly.
Good,
Like
good,
we're
good,
gonna talk
good.
about this stuff because I learned about it and I then went did more research and here's the things. Yeah, yeah. Okay, all right. So this is awesome. So what got you specifically to become interested in anxiety and social anxiety and all that?
Sure. So, yeah, it's been a lot of different pivots because when I was in undergrad, I thought I was going to be an architect,
Oh,
and
okay.
yeah,
Different,
really
different.
different. Yeah, and then I worked at a firm for a while. I was like, wow, this is not for me. And so, I mean, necessary job. Happy, glad people
Sure,
do it.
sure, sure.
Not for me.
Right.
And so I thought, like, okay, well, I took every psychology class there was at my university until I realized that I only had to take biology, and then I could get a double major. I was
Right.
like, if I did that for fun, maybe that's information.
Right.
And then I coordinated a student mental health program I participated junior year, coordinated senior year, and I was like, if I did that for fun, maybe
Maybe
that's
this is
information.
more than fun.
Exactly,
Yeah.
exactly. So, so long story longer, ended up switching careers and started working at a community mental health center that was doing primarily HIV research, but there was a
Mm.
fantastic psychologist there who was treating folks who had HIV and were depressed
Mm.
with cognitive behavioral therapy.
Mm-hmm.
But in addition to their depression getting better, their HIV got better. Their viral loads went down and their CD4 counts went up. And I was hooked. I was
Right.
like, oh, I have to do this. So, and then just like it's been a series from health psychology. I was working in HIV for a while and then moved over to cancer and then was doing cancer and anxiety through another mentor. And then
Wow.
that has just taken me to simply anxiety. And I was like, I'm home. These are my people. I was like, I found it. So I am forever going to be in my little anxiety nest and treating and researching that because
That's
that
your
is my
jam.
home.
Yeah.
That's my
Yeah.
jam. Exactly.
So,
Yeah.
so I have to ask, do you live with anxiety also yourself? Like, is this something that, or is this,
That is
I
a
mean,
great question.
everybody everybody gets anxious. I wouldn't say
Sure, of
everybody has
course.
anxiety, but everybody gets anxious.
Right.
But, yeah, have you experienced it or, yeah.
Yeah, no, absolutely. So I have never been diagnosed,
Mhm.
but and the more I through undergrad and graduate school, learning about social anxiety and learning how to treat it specifically, I felt like I was looking in a mirror. I was like,
Mm.
oh, there's a name for everything I experienced,
Right.
and so a combination of like at first it was kind of the blind leading the blind, like
Mhm.
just trying to figure out like I'm learning this and trying to teach it to clients as a student. But then like so seeing it work in two feedback loops, so seeing it work
Right.
in them and then like trying out some of the stuff myself, I was like, oh, okay, that's I like just definitely kind of a retroactive. That's what that was.
Mhm.
And so I definitely still have moments where I struggle with social anxiety. Being on camera actually is one of them. So I
Well,
um
thank you.
you got it, you got
Thank
it.
you.
So,
You're doing
but
great. This is
thank you. But yeah, no, and so that and like I think the last like the high hanging fruit is that and like being assertive to authority figures. Um, but like I've worked through a lot. Like I have figured out, I'm proud that I can talk to pretty much anyone, like and
awesome.
I can talk about some techniques
Mhm.
for that. And I now identify as a recovering perfectionist.
Oh, I
Perfectionism is
love
something that
that.
really
Mhm.
drives social anxiety.
Yep.
And so, like realizing that not everybody is holding me to these really high standards that I was holding myself to was very freeing. Yeah, but so yeah, I yes and no is the answer to your question. So I feel like I've come a long way, and no,
Mhm.
social anxiety doesn't control my life. It doesn't make my decisions for me like I think it used to.
Mhm.
But I remember,
Yeah.
like
Yeah.
I was there, and so I am on the same journey as my readers for the book, and so but I consider that to be a real privilege to be able to have that empathy moment and say, oh, I remember that, or oh yeah, I know what you're talking about, and in just getting feedback from the book, I know that that is something that people appreciated. That I wasn't like looking down from on high saying you should do this. That I was really
Right.
in the trenches with them. Yeah,
Right. Yeah. It just adds a little layer of empathy. I mean,
it does.
I think you can treat condition, like you don't have to have cancer to treat cancer, right?
Right,
You don't
exactly.
have, but it adds a little layer of empathy that, yeah.
It does. It
Yeah.
does. Yeah,
So let's talk about the book.
totally.
Let's talk about the book. I mean, this is so funny because it's on my Kindle, so it's not like I'm sitting here being like, let me flip
A
through. I have
black void of a cover.
yeah,
Right.
right.
Yes.
But yeah, let's talk about the book. So obviously, I loved it because you can't not. And I highly recommend that everybody read it. And that's not like that's not a paid endorsement. That's just like I read it and I love it, and it was very helpful and it was very insightful. And always, I find your just language is very approachable, very like. You
Thank
felt
you.
this thing, right? And then when you feel this thing, you could probably do this thing about it, and it's great. I can't recommend it. Is there an audiobook form? That's actually a great question. Is there?
There is, yes. And yeah, and so for better or worse, I narrate it, and I didn't realize how exhausting that was going to be.
Yeah.
It's like 4 days of being locked in a little studio.
Right,
But yeah,
right.
no, it was, yeah, no, there, it's long, yes, there is an audiobook version, and
Awesome.
get to slash have to listen to more of me. Yes.
Yeah. Oh my God. But like you had a podcast, so yeah, I'm
True.
totally
I think that's why they made me do it. Yeah.
Yeah,
Totally.
yeah.
Yeah.
I compiled my blogs into a book, and people have been asking me to get into a tiny studio and record it, and
Absolutely.
I'm like,
Yes.
it's great for accessibility, but like that's a long time to sit in a booth and
It
and do
is.
the thing.
It is.
Yeah,
That would
but
be great though. You should totally do that.
yeah, it's on the list. It's on the list.
Nice. Yeah.
But yeah, so what made you specifically decide to, I'm gonna sit down and write this book and make this conversation happen, yeah, in this form?
Yeah, I think it was an extension of like what I mentioned before in terms of just like
Mhm.
all the research being really siloed, or like it's not fair that only people who can afford private mental health treatment in this country, like then we could that's a whole nother thing, but like have access to really the cutting edge treatments, like that's
Mhm.
not okay. And so let me put all the the cutting edge of the science in a book that people can you can access for $15, and that is, I think, just why primarily why again I aspire to be a bridge. It's like when you're in
Yes,
kindergarten, what do you want to be when you grow up? A bridge.
a
So
bridge.
yes,
Yeah, I'm gonna
yes,
be a big,
yes.
strong
I'm gonna
bridge.
be a bridge. Yes.
Oh my gosh, I love it. Okay, so first I'm gonna ask you my questions about like just in general anxiety, and I live with
Totally.
it. And there's a lot of it right
Don't
now.
we all?
Yeah,
Yeah.
no,
Yes.
don't.
Especially now. Oh my
Yeah,
gosh. Yes.
yeah. Well,
Yeah.
so but I actually have diagnosed anxiety, and there are times where I kind of like forget about it and it's okay, and then there are other
Mhm,
times
mhm,
like right now where I'm like, I definitely have more than your baseline anxiety happening here. Like I
totally.
open when I open my phone some days, I literally start like shaking, my stomach drops, and I start feeling like nauseous, and
Hmm.
it's not great. So the physical symptoms are there, and just scrolling through and you feel that as you're scrolling through Twitter, you feel it getting worse and worse,
Yep.
and you wonder
I'm
why you
doing a
won't
lot of
stop.
nodding.
Yeah, a
Yes.
lot of
Yes.
not, and you just,
Yes. Yes.
but you don't stop for some reason. You're just like, this is good. This is what I'm. So that's my question, I guess. As comfortably as you want to talk about current events, we don't have to dive into that. But anyway, just in general, do you have any tips and advice for people who experience a lot of anxiety as we're going
Mm.
through all these things, and how it might be, what might be helpful?
Sure. Oh my goodness. So I guess here, so fundamentals are, so anxiety is driven by uncertainty.
Hmm.
Anxiety is the what ifs, or the what's gonna happen. And there is so much uncertainty these days. Like just any
Everywhere.
headline you
Yeah.
look at is filled with, whether it's about the pandemic or democracy
Right.
or like just what's going to happen. Like just every time I refresh the news there's more what ifs.
Right.
And so let me just validate relate that there is a lot more to be anxious about these days. There is just objectively a lot more uncertainty. Okay, so next, anxiety is also vague. Anxiety is something bad is going to happen. Like anxiety is very kind of amorphous and like it's this kind of cloud. It's not
Mm-hmm.
very specific.
Mm-hmm.
And it's always about the future. So none of us have a crystal ball. None of us know what's going to happen.
Right.
But yeah, but anxiety is, fear on the horizon. So, all those things match up in this like, kind of terrible, not perfect storm, really imperfect storm to
Right.
make us
Right.
feel more anxious. So, okay, so for the vagueness,
Mm-hmm.
you can try to specify, like to take it from that amorphous cloud and like, put it in a box and say like, okay, like what am I really worried about? And if you can specify it, then that is often easier to either argue with or realize that it might be just an anxious
Mm-hmm.
thought,
Mm-hmm.
or at least you can like get more information or like try to increase that's like to lessen the uncertainty to get more certainty around that. So if you're specifically worried about, I don't know, like one of my clients was worried that militias would come to his neighborhood
Oh.
and make him like threaten him essentially. And so, but we didn't know that. Like at first, it was just kind of this free floating anxiety, and then as we talked, it was clear that like that was the specific fear.
Mm-hmm.
And
Mm-hmm.
so we could
Mm-hmm.
talk about like, okay, how likely is that? Like you see it on the news, it's
Right.
right there when you turn on the TV,
Right.
but is it in your neighborhood?
Right.
Or we could say like, okay, like, that's happening in DC, terrible. And,
Right.
like, is this going to come to your neighborhood? Like given on, yeah, I won't tell you where he lives, but like, just, based on
Right. 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 Right.
geographic
Not
distance.
in
Right. Yeah.
DC. Not in DC.
Right. And not indeed that far away from DC. Exactly. So specificity can help you really challenge the anxiety,
Mm-hmm.
specifically with doom scrolling. Also, just like put some limits on it. Like that,
Yes.
anxiety gets as is like I like to say it's like a fish that gets as big as the tank that we put it in. And
Uh-huh.
so like I was doing this as much as anybody else. I was doom scrolling, all
Mm-hmm.
fall and
Mm-hmm.
like I have a colleague who now has carpal tunnel syndrome from
Oh
doom
my God.
scrolling so much. So
That's
you are not
that's
alone.
the
If
perfect
you
storm.
are,
Like not only are you doom
I
scrolling,
know.
you're now having an injury. That's great.
Exactly.
Okay.
Exactly. Yes, you are adding injury to insult. Anyway,
Yeah.
so yeah, so to just like you don't eat junk food all day long, just like it's like you try to limit your intake of like junk food. Also try to limit your intake of like what is not good for your mental health. Like sure, keep up with the news, but maybe look at it like at two designated times during the day, or like not right before you go to bed. That was my problem, which was terrible.
Mm-hmm.
And
Or right when you wake up. That's a great way to start
oh,
your
right,
day.
right, yeah, yes, like no, yeah, no. I had another client who was like, okay, so does everybody either looks at their phone before they pee or while they're peeing like, in the morning?
Yeah.
And
Yeah.
so right, so just to try to shrink that tank that you put that fish in, so it can't get bigger. So
Mm.
those are my
Those are great.
two.
Those are great. Oh my
Yeah.
gosh. I'm okay. All right. And I'm noodling all these things over. And
Noodle
so
away.
and so to kind of go back to okay, not everybody has anxiety. As I was reading through this list of 25 things, out of which I had 16, and wondering the thing that I wondered to myself was, and I feel like this is maybe too often discussed, but maybe not discussed often enough. The fact that there is kind of, when we're not in a pandemic, when we're not seeing democracy explode in our country, there is a baseline of anxiety that, we experience. Like one of the things was you get anxious before a test. And I'm sitting there going, oh no, I thought everybody gets anxious before a test, right? So how can we specify and how can we say, I mean, obviously, I always say if you can, go to a professional and have them diagnose you and talk to you, but not everybody has access to
Absolutely.
that.
Right.
But so how do we determine like, hey, I should probably talk to somebody about this versus like, no, this is probably a healthy area of
Yeah.
anxiety.
That is a great question. I'm so glad you asked that.
Yay.
So the two lines that you want to watch out for are called distress and impairment. And so, because yeah, you're right. It is normal to get anxious before a test, but is it normal or typical or whatever to like lose sleep for 3 nights, or to
Right.
get so anxious you throw up, like.
Right.
And so we're looking for distress, like, is this disproportionate to the situation? So, like, sure, you're going to get a little anxious before a test, sure, you're going to get a little anxious, or maybe medium anxious before a first date, or you're going to, yeah, there are lots of reasons to be anxious. But if your anxiety is disproportionate and causes you distress, meaning that basically it freaks you out,
Hmm.
that it's hard to concentrate on what you
Right.
need to concentrate on, like it's kind of like your mental screensaver, like whenever you're not actively engaged in something else, your brain goes back to that thing.
Right. Right.
Like, yeah, that's one possibility. Like, and it's upsetting, like it's like that you.
Yeah. It's
Anyway,
uncomfortable.
distress.
Yeah.
Right,
Yeah.
it's uncomfortable. Okay, and then impairment means that it keeps you from living the life you want to live. So for
Mm.
social anxiety, for example, if you turn down a promotion because you would have to therefore give presentations, or you'd have to like travel and like meet new colleagues all the time, like that's impairment. Or if you, my favorite one is like for students, like if you deliberately forego the 20% of your grade that is class participation because you can't raise your hand, that's impairment.
Hmm.
So those are the two lines you want to watch out for in terms of like, is this a problem? But fundamentally, you can just also ask yourself, is anxiety causing problems in my life? And if so, yes, I have a problem.
Yes. Okay. All right. Okay. I mean, fair enough. Yes. And I'm listening to this and going, yeah, yeah, no, that was still right. I'm still right. I woke up last night and just laid there thinking about a conversation I had with somebody, like the day before, and being like, I feel like I was really stupid. I feel like what, I said that. That's what I said, and it was like 5 a.m. That's not what I
So
need to be
common. Oh
doing.
my gosh. Yeah, right. To stare at your ceiling and ruminate. Exactly. Yeah.
Right. Right.
You are
Right.
not alone, let me just tell you. Yeah.
Well, yeah, otherwise, I mean, like you wouldn't have research to research, so.
Right. I mean, I think it's I think it can be validating or normalizing to realize that like these things are so common that they have a name. Like that so many people do this that like there's a name for it. And yeah, by extension that it can be treated and dealt with.
Yeah. Yeah, I do that with conversations I had like 10 years ago, says Isle and the Unmighty in
Oh
the
yeah.
audience. Yeah, yeah, absolutely.
Yeah.
There's not like a
Oh yeah.
time
Yeah.
limit. There's not a statute of limitations on like old,
Ever.
yeah, on old discussions.
Right. And it always comes like when you're doing something mindless, like you're folding, like, okay, I'm just gonna say I rather than the second person, like
Yeah,
when
yeah,
I'm folding laundry or
yeah,
brushing my teeth, like pow, like,
yeah,
oh my God, why did I do that? Yeah,
yeah,
it comes back into your head. Totally.
yeah.
Those are actually called cringe attacks, like colloquially.
Oh my
Yeah. Like
God, I'm gonna use
there's,
that.
yeah, no, there's research on it, but it's called brain pops, which I think doesn't. I don't love the name just because it doesn't imply what it really is. But I
Yeah.
think cringe attacks is
Cringe attack is
truly
fair.
what that
Oh
is.
my
Cringe
God.
attack. Yes.
It's so
Yeah.
perfect. Oh my God. You got attacked with your own cringe.
You
Oh my-
did. You did.
And it is when you're doing, yeah, you're like minding
Yeah.
your own business. And then all of a sudden you're like, when I was little, I sure did embarrass myself. Yeah.
Mm-hmm,
Oh
mm-hmm.
my God.
Yeah.
That's a mood and
I'm
a
like
half.
brushing my teeth and like, oh, when I was in 5th grade, I threw up in front of, then
Yeah,
like you get
yeah,
yeah,
yeah.
exactly, right.
You're like, thank you, brain. That information was completely useless to me right
That was
now.
necessary, right, and
Right,
helpful. Thank
right.
you. Right.
Thank you.
Exactly.
Thank you
Yeah,
so
yeah.
much. Oh my gosh. All right. So we have our first question in the queue. For everybody who doesn't know, you can enter your question. First of all, the instructions are if you write in exclamation questions, who give you the instructions, but the instructions are exclamation list and then your question, so you can be entered into our queue so that we can. It's easier for me to yes, thank you, Bliffle. It's easier for me to sort through everything. So Music Mind 97 asks, Dr. Hendrickson, any thoughts on anxiety stress inducing physical symptoms? I guess it's a little bit broad, so we can narrow it if we need to.
Yeah, that is a thing. So I mean, okay, so I'm a psychologist, so like I look through the world through the lens of diagnoses, for better or worse. And so there's a diagnosis called GAD, generalized anxiety disorder, excuse me, of which one of the hallmarks is physical tension. It's anxiety that feels uncontrollable. And physical tension. So yeah, that's one of the two pillars of that. But yeah, so in terms of dealing with it, there's a lot. I won't do this for too, but like
This is what I need you to do. Go into as deep. Tell me the research. This is what you're here this is the channel to do that on, I swear.
Sure. So, I mean, I'm not going to go over, this is all tip of the iceberg
Okay,
stuff. And
right,
so,
that's
like,
fine. We're not going to get a PhD after we walk out of this
we could
conversation.
talk for days. Right. So, and at the same time, I think also your community deserves more than a 5-minute answer. And so, like, it's
Sure.
just like you say, if you do have access to a professional, like, do that. That is fantastic. And so, but for physical tension, relaxation exercises, like you can find the empirically validated stuff. So, progressive muscle relaxation, which you can just find on YouTube. It'll walk you through
Mhm.
a progressive muscle where you tense and relax. And what that does is it teaches your brain to recognize when you're tense. Because oftentimes we walk around like with our,
Yes.
shoulders up in our ears and we have no idea.
Yes.
And, and so it teaches you to recognize that you are tense and then to consciously relax. And so PMR can be helpful for that. Any kind of yoga-based breathing can be super helpful. And then you can, the mind-body connection is redundant. Like that's the same thing. And so really anything you can do to cognitively or even behaviorally reduce your anxiety is going to help your body as well.
Awesome. Yeah, that makes a lot of sense. Interesting question from Shadowhawk, and I don't know much about this, so if you're like, I don't know much about this, that's okay too. But I know TMS works for depression. Does it work to treat anxiety?
That is a great question. I am not going to make up an answer because I don't know enough about TMS to really give you an answer that I would consider to be sufficient. So
perfect.
We love polite
that.
pass.
We love polite passes here. All right. Okay, wait, I gotta refresh our handy dandy list. Bliffle Splick asks, are there any stories that really struck you from your research, or I guess that you may have mentioned in your book, and can you share one or two?
Oh, sure. Oh gosh. Oh, what are the? I've got so many. Sorry, it's hard.
I know. I'm assuming years of practice. You don't have just one that you're like, one time.
Right.
One time I had somebody who had anxiety. One time.
Exactly. Okay. Let's see. So, okay.
Would it help if we specify? Oh, sorry. Go ahead.
Can we specify? Yeah. No. Go. Yeah.
If we could specify like maybe a scenario.
Yeah.
So let's say somebody who has. So something I think that a lot of people in the audience can relate to is somebody who has social anxiety to the point where being it. So as content creators, we have to go to conventions a lot, and that's how we meet sponsors, and that's so. And we meet people who watch us, and I can talk about parasocial relationships for hours, but specifically, so maybe a scenario in which somebody who had social anxiety, specifically with, being in large crowds, being in big situations like that, where you have to present yourself and, maybe give a good impression to like a lot of people at once.
Yes.
Okay. All right, let's go.
Okay.
Let's go.
Right. Okay. So I was working with, I'll try to do this without doing identifying details, but I'll try to change some in my brain. Okay. So a civil rights lawyer who had to give a ton of presentations about like sexual misconduct and like community standards and like really politically charged things that would often put him in front of a not hostile audience, but like he would get asked a lot of tough questions. And so he would rely on his slides and would read the slides verbatim, or like it was, and he knew that he was not giving a good presentation. He knew that he was not connecting with his audience. He felt anxious, like he was about to be called out, like at any moment that like the crowd would turn on him. And at one point, like prior to him coming in, they did, like he really got, put through the ringer. And so we worked a lot on turning his attention inside out, because when we feel like we're on display, when we feel like we have to perform, we oftentimes will turn our attention inward. And ask our anxiety how things
Right.
are going, and inevitably our anxiety is going to tell us that we suck, right?
Right.
Okay.
Right. Right.
All right. And also, that's when we start to overthink things. We start to self monitor and really focus on, like, okay, like maybe I would look more casual if I had my hands in my pockets, or like
Sure. Sure. Sure.
maybe I should lean against this wall, or like, or
Right. Right. I look so cool and chill.
act
Yeah.
cool.
Act
Right.
cool.
No, and so we keep on thinking about, like, overthinking what we're doing, either with our body, or we like think we rehearse what we're gonna say in our head before we say it, or we check what we just said to think, like, did that sound offensive? Was that weird?
Mm-hmm. Mm-hmm.
Did I sound
Mm-hmm.
stupid? And
Me
so
on Twitter every day. Uh-huh.
of course, of course. Yeah. And so, no, I don't check my Instagram captions like 4 times
Four
before
times. And
posting.
then
Never,
after
never,
you posted
never,
it
never.
4 more times. Yeah.
Four
Mm-hmm.
more times.
Mm-hmm.
Exactly. I never find anything. Anyway,
Yeah.
yes. So never happens. Right. And so we turn our attention inward and we self-monitor, and that eats up all our bandwidth. And so that's why there's little left over for actually paying attention to the moment, or realizing what we're doing. So that's why we spill our drink on somebody, or we trip over our own feet. We make things worse because we have so little bandwidth left over because we're busy looking inward. So he and I worked really hard on turning his attention outward,
Mm-hmm.
and to look at the audience, to really focus on connecting with them, as opposed to kind of staying safe inside his head, or safe inside the presentation, like reading the lines.
Right.
So that's one, to turn attention outward.
That's
Um,
really, really great. But
but
that helps other people connect with you too. So it's it's
yeah,
it's
yeah, yeah,
it's a
yeah.
twofold help. Yeah. Okay.
Exactly. All
Okay.
right, I'm going to go into the weeds a little bit here.
Go
Okay,
for it.
so okay, so I think what I should have said first is that we can decide where our attention goes. Our attention is a spotlight, right? And you get to choose where to point it. So an exercise that I like to use with clients is that we'll use the example of head, shoulders, knees, and toes. And
Okay.
so, like, okay, so you don't just sing or do anything, but like, so just bring your attention to the top of your head.
Okay.
Now bring your attention to your shoulders. Now bring your attention to your knees, and then bring your attention to your toes. Like, you can shift where that goes, right? Like,
Right.
without having to do anything.
I
You can
like
just
feel calmer. Just okay.
you can focus your attention where you want. And so, okay, so the next level is, if you try to replicate kind of a socially anxious moment, like turn your attention inward, like if you're thinking, oh, like maybe I like what should I do with my hands? Like what do I, like, what if you like kind of turn your attention inward and like replicate how you might feel when you're at a conference, or when you're on the spot. Okay. And now turn your attention outward and like look around the room, listen to my voice or whatever you might hear in your house, and turn your attention outward. And you see,
Mhm.
like, like, it's hard to describe it, but did you
No, I
can you
I
see
like
what
that.
that
It's
is?
it's
Yeah,
grounding. It like
it
it
is.
just changes what you're focused on to make you to yeah. So
Right.
you're not in your head, because a lot of
Yeah.
anxiety and
Yeah.
people will very unhelpfully say like, "Oh, get out of your head," but like that doesn't work. But if you give
Right.
them a
Right.
literally a technique that gets them out of their head, that's way more
Yeah.
helpful.
Yeah, so you can even picture like a spotlight, and you decide to point it at who you're talking to. And so, like, if you're listening, like, your task at hand, you want to point your spotlight at what you're supposed to be doing,
Right.
not at your
Right.
not at your inner critic, not at your social anxiety.
Mhm.
So you point it at what you're supposed to be doing. And oftentimes that's listening. And so you can, listen wholeheartedly, and that will allow you to feel less anxious because you got something to do, right?
Mhm.
Again, anxiety is driven by uncertainty.
Mhm.
Or if you're talking, so this combines here, we can do like a little remix of skills here. There's another skill of give yourself a mission, because
Okay.
social anxiety particularly is driven by uncertainty. That's why kind of mingly situations, or like parties, are a lot harder than something structured. Folks with social anxiety often do really well when there is structure. Like, if you know what you're supposed to be doing, like, okay, I'm going to play this part in a play, or I'm going to get on stage and I'm going
Sure.
to play this song. Like,
Mhm.
if you know what you're supposed to be doing, there's no uncertainty, like, then we feel fine. But if it's unstructured, we're like, I just have to be me, and like I have to go
Right. Right.
navigate this party for 2 hours. I have to
Right.
navigate this conference. Like, what? So then, if you can give yourself a mission, give yourself some structure, like to create that certainty. So say, like, okay, I'm gonna get three people's contact information, or at a party, like, I'm going to talk to
Ah,
two people I've never talked to before.
okay. So not just focus on the
Yeah.
cat?
Right. Exactly. But tried and true, right? I
Yeah.
mean, and you can step in and out. You don't have to push yourself the whole time. You can go pet the cat. You can go hide in the bathroom. That's fine. Just come back, right?
Right, right.
It's totally okay to give yourself a break. Go out on the balcony and be like, ah, and then come back and like, try to chat and connect with
Right.
folks. Again, turn your attention inside out. Give yourself some structure. I hate my company's holiday Christmas party. Don't tell anybody. And so I go and I say, okay, I'm going to talk to each person I supervise. I'm going to talk to the office manager. I'm going to talk to my boss, and then I'm going to leave.
Yeah.
And that gives me some structure. Like
Yeah.
that gives me a purpose. I'm like, okay, and I often like end up having a good time and stay longer than I intended to. And just anyway. And so, yeah, I'd say those two skills, turning your attention outward
Mhm.
and giving yourself some structure, are both really helpful. And to make this long story longer, I'm going to take you out to more.
Yeah,
bring you back
let's
to the Shire.
go.
Okay, so for this client, with his presentations, he was able to start turning his attention outward rather than like staying
Mhm,
in his
mhm,
head
mhm,
or
mhm.
staying in his presentation, and also focused on like, okay, my mission is to convey the mess, like the values of the university.
Right.
I'm here to say that like we are a resource, and like we're open to them. That's my mission. And so rather than just reading slides, he was able to talk more naturally because
Right.
he knew what mission he had to fulfill. So
Right. Right.
there's a story plus some tips.
No, I
Yay.
love. Oh my God, that's like bingo right there. No,
Uh,
that's so great because that works. I mean, it's interesting because I feel like I've implemented that technique without like realizing it because
mhm.
that's where I know there's comfort is like, okay, my next thing that I'm going to do, okay, going, to a convention,
Yes,
terrifying.
yes,
But if I
yes.
say next thing I'm going to do is going to go talk to three new people. Oh my God, that's terrifying, but that's
Awesome.
what I have
Yeah,
to do.
but
Yeah. Yeah.
exactly.
Yeah.
Yeah.
Oh, awesome.
It's always fun when you discover that, like when there's that overlap of like, oh, I
Yeah.
discovered this, and like, and this is like what the science says, like, oh, cool, like,
Yeah. Oh, cool. I'm so
hooray.
smart. Good job, me.
Yeah. I'll give one more example.
Yeah.
So anxiety is really driven by perfectionism. That if we have this inner rule book, and in social anxiety, that inner rule book is really rigid and really arbitrary. And
Mhm.
so it says things like, I have to be cool and confident, or
Sure.
I have to be funny. I have to connect with everybody. I need to speak in articulate
I,
paragraphs.
I don't
I
know what you're.
always have to
I'm
have
not. I'm
something
being attacked.
interesting to say.
I don't know what you know. Uh,
No, right. And so, I mean, okay, so it's rigid
mhm.
because it's always, and if you don't reach this, you failed, right?
Right.
Okay, so first of all, and second of all, it's arbitrary because you would never hold anyone else to those same standards. You
No.
would never expect
No.
anyone else to, like if they're going to speak in a work meeting to have a fully formed idea and say it in an articulate paragraph, yeah, you would never expect that, but you expect yourself to do it, right?
Right.
So, okay, so I work with a lot of folks with perfectionism, and that has a lot of overlap with social anxiety, but also with OCD. I'm thinking of one woman that I'm working with during the pandemic for germophobia, and this is
Oh
hard.
my
Hard
God.
story.
Okay. I hope my
but
sister's watching right now.
but
Seriously. Okay.
but she's doing great. And so,
Hmm.
okay, so this now I'm going to broaden this to like all anxiety, not just social. So like OCD, generalized anxiety, even
Hmm.
PTSD to an extent. So avoidance is what
Yes. Hmm.
feeds and waters anxiety.
Right.
And so when we do the thing that we are afraid of, when we face our fears, then we gather information that refutes what I call the two lies of anxiety. One is that the worst case scenario doesn't always happen.
Right.
It doesn't usually happen, quite honestly.
Right.
Okay. And
Right.
then second, we can handle it. Because when we
Right.
avoid things, when we avoid, in her case, germs, or
Hmm.
in the case of social anxiety, places where we feel like we're going to be revealed,
Right. Right. Right.
social
Right. Right.
anxiety, to go on a tangent, is the a worry that there's something wrong with us, like a worry that we are incompetent or not cool
Right.
or not fun, whatever,
Right.
like some kind of fatal flaw, and we're worried that that's going to be revealed, that people are going to we're gonna be in a situation where it will become obvious to everyone that we are deficient in some way, and then we'll be judged and
Right,
rejected.
right,
Okay, and
right.
so avoid, any situation where we're worried about that salient reveal. For, generalized anxiety, oftentimes avoiding risks is a common avoidance.
Mhm.
Anyway, okay. But when we consistently avoid things, then we never get to learn through experience that, again, the worst case scenario is not always going to happen, or not doesn't usually happen, and that we can handle it. And that when we do push ourselves out of our comfort zone a little bit, I always say inch your way into the pool. Don't do a cannonball. We're not trying
Sure,
to put you
sure.
in the terror zone. We
Right.
just want you out of your comfort zone. So a little bit,
Hmm. Hmm.
baby steps. Then you can learn experientially, that you can gather evidence and experience that you're capable, and that usually things are fine. But I totally understand avoidance is highly reinforcing. Like, it feels
Right.
really good to have
Hmm.
that anxiety go away. So, but I also, but like, to remember that what goes up must come down. That if
Hmm.
you stay in a situation that makes you a little bit uncomfortable, a little bit anxious, again, inch your way into the pool, then, like, I'm just going to draw this.
Oh my
So,
God, yes,
so
we got a diagram. Yes.
I use so many. I'm so nerdy. I use so many graphs,
Oh my God, I
and so
love it. You're in the
so I
right
might as well
place.
just do this.
You're
Yeah,
in the right place.
good, good,
That
good,
girl,
good. All right,
that girl Bryce just said, I have a gold medal in avoidance. Yeah. Yeah.
that's a great way. I love that.
Yeah.
That is a perfect way to say it. All right, so I'm just drawing this on random paper. Okay, so this is as time goes along.
Yep.
Here's anxiety. This is
Yep.
none. You're on the couch,
Sure.
you're watching Netflix, and this
Sure.
is your head blows off. Okay, great.
Right.
All right. So, all right.
Okay.
So
All right.
you encounter an anxious moment. So, like,
Mhm.
let's pretend this is social anxiety, and you're sitting in class, and the the teacher's going to call on you, or does call on you, like, ah, and
Mhm.
so this feels terrible. And
Right.
so then, if we say, oh, pass, or like, I don't know, I don't have anything to say, like, whatever the avoidance is, when we go hide in the bathroom, or we, cancel plans with our friends, or we, whatever it is, then, like, this is like crack, right? Like, this feels really good.
Mhm.
But then what happens is we get into this, like, yo-yo pattern,
Mhm.
where because we avoid it again, right? Like,
Mhm.
we're inevitably going to encounter that anxious situation again, avoid it, da, 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 da. That sucks. That is why anxiety in all its forms gets maintained for, years, decades even, because that cycle of avoidance keeps us stuck. And so what we try to do is to encourage people to, like, this is not fun. I'm with you on this. Like,
Right. 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 Right.
I
Right.
get that sucks, but, like, again, inch your way into the pool. Don't do the hundreds, like, on the 0 to 100 scale. It feels like this is going to happen, but nobody ever died from anxiety, right? Like, nobody's head actually ever blew up. And what
Sure.
goes up must come down. And so eventually, what happens is that this happens. And it's on this side of the curve that the learning occurs. And you're like, oh, that was actually okay. Nobody
Right.
laughed at me. You're like,
Right.
oh, like, these people are actually friendly. Oh my gosh, who knew? And I could handle that. Look at me. And so, because when you stick with it and do the thing, it sets up a feedback loop to yourself, where you see yourself doing it.
Right. Right.
And
Right.
so
Right.
you
Right.
start to think you can, right? You put behavior, or you put action before confidence, and then your confidence catches up.
Yeah. So
So, yeah,
there's research behind just you're reinforcing your own positive behavior, right?
yeah,
You're saying
totally.
hey,
Yes,
this worked. I'm gonna do more of this thing that worked. But if avoidance is the
exactly.
thing that's working for you, you're gonna
Right,
do more of that
right.
thing because that's working for you.
You got it. You got
Okay.
it. You got it. Okay. And then, okay, so
But
then,
wait, there's more.
but wait, there's more.
Okay.
So as you do the thing again, like, if you go to another conference, or you get called on again in class, or whatever, and
Yeah.
you try to muddle through the question, or you
Right.
go
Right.
try to
Right.
get some contact information, then both the intensity and the duration of your anxiety declines. And so over time, you got to do it again and again. It doesn't work just once, although your brain recalibrates pretty quickly.
Sure.
And so then, that's how anxiety gets better. To
Yeah.
do the thing, and then
Do
and
the
so
thing. Try the
do
thing.
the thing, go forth and put action before it's okay. Here's another way to say it. It's just like we oftentimes feel like we have to feel like doing something before we do it. We have to feel like
Ah,
lacing
right.
up our shoes before we go to the gym. We have to feel like sitting down to host a show, before you do it. Um, but really, that's not true. Really, what we can do is if we have enjoyed it before, if it's something that we value, we can put action first, and then our mood will catch up. We can go to the gym and just go through the
Ah,
motions,
right.
and usually we're glad we went, right? We can
Right.
sit down at the piano and start tooling around, and then inspiration will find us. And so to put action first. Same thing with confidence. You don't have to feel confident. You have to wait to feel confident before you do the thing. Just, try to do a smaller version of the thing. Again, inch your way into the pool. And then your confidence will catch up once you get that feedback loop. You see yourself doing it and you start to believe you can.
Yes.
That gets rolling. Yeah.
Yes. Oh my gosh. Okay. All right. So you think you can, so then you can. And if you think you can't, you can't.
Yeah, you see yourself on camera and you're like, oh, look, nothing bad happens when you're on camera. Like, imagine that. So, yeah, for example.
Yeah, love it, love it, love it, love it. So
Yeah.
that's a lot of examples. So thank you so much
There's a
for
lot of
that.
examples.
That's
Yes,
a great amount of examples. Okay, all right, let's
no worries.
see. Oh, that's so great. No, I love the graph, and we got a graph, fam. We got a graph. Okay.
I'm such a nerd.
Oh
Yes,
my
okay.
God, I said, and I'll say it again. You are in the right place. You know.
Good.
Uh,
I am home.
Nighttime Blues asks, how can you deal with overactive self-censoring? I will go to say something and my brain will whisper, no, nobody wants to hear you, idiot. So it either comes out all mixed up or I just say nothing.
Yeah. Validate, relate. So, okay. This is actually I'm glad this question was asked, because this is, I think, where perfectionism comes in. Like, I have to say the right thing. I have to, whatever that internal rule book is saying, like, I have to be funny, or I have to be cool, or I have to not sound stupid, I have to sound confident. So to rethink that, like, again, rigid and arbitrary, right? So with rigid,
right,
then, like, if you don't reach this bar, like, you fail, right? Like that. And so, and it comes out as I keep on saying rule, but that's essentially what it is.
Yeah.
So instead of a rigid rule, we want to try to grow a flexible guideline. Like, I prefer not to offend anyone.
Sure.
I prefer to speak in complete thoughts.
Right.
I aim to be friendly as often as I aim not to. I don't know. Like, okay. Here's an example. Okay, so I have a client who's a med student.
Okay.
And she is having such a hard time in her clinical rotations because she carries around these rigid rules of, I can never offend anyone, even by accident.
Right.
I always have to say the right thing. I have to get this exactly right when I'm talking to either the attending or the patient.
Checking off all the boxes in my head.
Yeah,
go on.
exactly. And so she will she will often stay silent, or she will ruminate after the fact about, oh, I think that was unprofessional, or, oh, I think, like, and so and she has a rule in her head of, I need to be accurate. And so there was one time where she had to write a note where she had to say that this particular patient was non-compliant with a medication that they were taking. And so she was between this rock and a hard place of, oh no, I have to be accurate. I have to say they're non-compliant.
Right.
But what if they read this, and because like your medical record is your property, right? Like, the patient could see this. Like, but what if they get offended that I say they're non-compliant? And so she literally she ruminated for 4 hours about how to word this. Bless her. And so we were currently working on trying to change those rigid rules to flexible guidelines. And so we're saying, I aim to be, accurate.
Right.
And I prefer, not to hurt people's feelings, but also, you can change your rules about yourself, but you can also change your rules about people. People can handle things. People are generally forgiving. People are pretty flexible. Interactions are cumulative. Like, it's not do or die with every individual interaction. Like, if people, give you another chance, or if you,
Right, 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 right.
if you're texting your friends, you're like, oh my God, did I offend them? Like, probably your friendship can weather some ups and downs, or some
Yeah.
little blips and bloops. Um, and so trying to change those rigid rules into flexible guidelines. I aim, I generally, I prefer, gives you some room to move, some room to breathe. And then you don't feel like you're walking on this tightrope as much anymore. They're actually like kind of strolling down this freeway. And
Yeah.
you're allowed to make mistakes. You're allowed to have some variation. It's not do or die with everything that comes out of your mouth.
Oh man. But it's the internal dialogue. So
Oh
how,
yeah,
yeah, making the internal dialogue a little bit more flexible is where it's at.
right,
Yeah.
right.
All
Yeah,
right.
you're not lowering your standards. You're just making them more flexible. And the thing I should have said also is that you're making them such that you don't hold yourself to a double standard. That if you would
Yes.
expect someone else, like, okay, so like with my med student, she would
Mhm.
never expect anyone else
Of
to,
course not.
like, oh, right, only ever say complimentary things, or
Right.
only ever, be 100% accurate, which
Right.
is like, that's why you're a student. You're learning stuff. You're supposed to get
Right.
stuff wrong.
Right.
And so, but she holds herself to that. So
Hmm.
you need to make sure that your rigid, arbitrary rules are flexible and egalitarian
Yeah.
guidelines.
A little bit softer. Be nice. Be
Yeah,
nice.
be nice, be
Be nice.
compassionate to
How do
yourself.
we
Yes,
summarize that? Be nice. Yeah. Uh,
exactly.
I can't take any more questions because we are coming up on time, but this is so exciting. Okay. Music Mine asks, I've personally found fencing to be a great exercise for reducing stress. Are there any favorite exercises that you found to be good? I'm going to start with saying I'm a yoga instructor, so we do favor yoga here. But
Awesome.
I would love to hear, yeah, yeah.
Yeah, I think for anxiety, any activity that consumes your full attention. So fencing, I can
Uh-huh.
totally see that, because
Hmm.
like you can't think about the thing that you said, 4 hours ago to your friend, and whether that's offensive, when you're trying not to get, I don't even know the lingo, but like stuck with,
Yeah,
somebody
yeah,
else's sword, right?
yeah.
Or like rock climbing, like if you're trying to, not fall off the wall, like you're not thinking about the, test you have to take tomorrow, or the
Right,
presentation you
right,
have to
right,
give
right.
next week. So things that consume all of your attention can often be a really nice break for an anxious mind, and are like kind of mindfulness by mistake, right? Like that's keep putting your attention on something deliberately. So the John Kabat-Zinn definition, paying attention on purpose in the present moment without judgment.
Hmm.
That's, if you can find that, like you're golden. So yes, so hooray for your fencer. I think that's a great
I
discovery.
love that. I love that. Although the rock climbing thing, I would not work for me because I'm terrified of heights, and I tried.
Yeah, no,
I
not for me either. Right. Yeah.
I did. I tried in college, and everybody was like, "No, you got it." I was 2 feet off the ground, and I was like, "This isn't helping anything. This is making everything worse."
Right. I mean, but you could, you could read thriller. It doesn't have to be
Yeah, yeah, yeah,
something
yeah, yeah. No, I'm
physical. It
just
could absolutely be something physical. But yeah, again, anything that induces flow, takes your full attention, totally,
yeah,
totally game.
yeah. Zuki
Yeah.
says dancing is a good one for me. Yeah, I bet like
Totally.
anything. Yeah,
Yes.
yes,
Yes.
yes. Where the next movement has to be like premeditated. Yeah, I like
Got
that.
it. Yes.
The next question is from the porcupine. What is a good way to get over social anxiety to talk to strangers to make new friends? So we kind of touched upon this, but we didn't touch upon this little angle of like, okay, now I'm trying to make a friendship. So
Yeah.
I fall into the category of I have to be the best person in the world. Otherwise, people won't like me. So I better have
Yes.
no flaws when they talk to me. I
Right.
better and you
Totally.
talked about this perfectionism, but it's very
Yeah.
much like I better agree with everything they're saying, even if they're saying something that I might not agree with. I have to find a
Mhm,
way to
mhm,
like
mhm.
nicely not agree with what they're saying, and just in general. And this is not how you make friends, because eventually
Right.
people figure out like, hey, we don't have a lot in common. You just yesed me to death, and I thought
You
we
just
did.
Yeah, right. You just agreed with everything I said. Yeah.
Right, right, right.
Yeah. Yeah. Okay. So, oh my gosh, I wish we had more than the time we have, because I
Ah,
could talk about this for a long time. But okay. So, one is folks with social anxiety often keep their lives very close to the vest. That we ask a lot of questions, we will, we're good listeners, but we don't reveal a lot. We make people work really hard to get to know us.
us,
And
yeah.
so, one thing to do is to try to talk more about yourself. And so I know that sounds weird in a culture where everything is already kind of me, me, me. But with social anxiety, it's different. With social anxiety,
Oh
again,
my
like
gosh.
people think that if people really get to know them, then oh, they're going to be revealed like that, whatever that perceived fatal flaw. And I emphasize perceived. That's why this is a disorder, because that perception of a fatal
Hmm.
flaw is a
Hmm.
distortion. But so to try to talk more about yourself, what you think, do, and feel. It doesn't have to be deep dark secrets, doesn't have to be confessions, even like what you had for lunch, the fact that you have a song from the grocery store like going through your head, now you can't get it out, like the most recent book you read, and do they have any recommendations, like what, it doesn't, anything about you can give them something to work with.
Hmm.
And also when you do a little bit of a disclosure, and again, not deep or dark, just anything
Yeah,
about
yeah,
you, what you think, do, and feel, you often get something back. And so this like reciprocal, um like personalistic, I'm very getting very clinical here, disclosure, like that's how intimacy is, that's how you make a deeper friendship. Like you tell them a little bit about yourself, and then they tell you a little bit about themselves, and then you say, oh yeah, well I relate to that, and they say, oh I remember that, and then that's how it gets passed back and forth. So one is to talk about yourself, and then second is to get more comfortable talking with strangers, talk to more strangers. It just do the thing. um what was the question again? There was something else I wanted to say. I don't remember what it was.
Good way to get over
Yeah.
social anxiety: talk to strangers and
Yes.
make friends. Hmm.
Oh, friends. Yes, yes, yes.
Yes.
Okay. So friends. Um, the a big myth of making friends is that shared interests need to, that we need to share. We need to share interests. Like we both need to be into, whatever, kickboxing or
Hmm. Hmm. Hmm.
horseback, whatever. Okay, possible. However, shared interests are really just a proxy for repetition. That we are friends with the
Uh-huh.
people we see most often. And so, like, if you are part of a, I don't know, community softball league, and you have a practice every week and a game every week, you're going to
Right.
see those people twice a week.
Right.
Or like that's why we often become friends with people at work or our roommates. It's the people that we see all the time.
Uh-huh.
And so there, I think, like start with who you already see, like that is a
Oh,
fantastic
okay.
way to try to increase your friendship pool. But like strangers too, but to try to focus on um putting yourself in a position where you're gonna see the same people over and over again. And so like if it's a one-time meetup, or it's a I don't know, like even if it's a class but you don't have to interact,
Hmm.
or like that, probably those are not going to work as well as if you are in a place where you see the same faces consistently over time.
Hmm.
So if you take a, like if there's a dance class that you take, that the same core people show up, or you show up at a
Right.
dog park every day at the same time of day and the same people bring their dogs, or if you, I don't know, just yeah, anything that is a proxy for repetition
Yep.
is gonna get you farther than like one time
That makes
events.
that makes a
Yeah,
lot of sense. I made
yeah,
really good friends with people that we were all in a corgi club together. It's a statewide
perfect,
club of corgi owners and corgi
totally
aficionados, and yeah,
perfect.
yeah,
Right. So yeah, so shared interest and repetition.
yeah.
Yeah,
Oh
yeah.
my gosh. Oh my gosh. This is so delightful. Thank you so much for answering so many
Of
questions.
course,
I
of course, I love this.
this is so awesome. Thank you so much for being here. Please tell us all about the things that you want people to check out on your behalf. I have the
Sure, sure,
link to
sure.
your website,
Yeah.
to your Instagram, to your book on Amazon and IndieBound. So yes, please.
Awesome. Yeah, I think for social anxiety, the book I is where you're going to get the most value. So it's called How to Be Yourself, Quiet Your Inner Critic, and Rise Above Social Anxiety. You can get it where you buy books. And then in a month or so, I have a people learn in different ways, and so I have a video course coming out that will be
Oh,
available on my website. It's the
oh,
same thing. But if people have other course requests, I'm again trying to get over my. I'm on the same journey as you, trying to get over my fear of being on camera, and so as I'm learning just as much by making these video courses, and would love to hear what people want to know more about. But that's coming in the next month or so if you want to keep an eye on the
Oh
website.
my gosh.
So,
Yes, I
yay.
will. I will. This is so exciting. Oh my goodness. Well, thank you. Thank you so much for being here.
Thank you. Absolutely.
Oh, this was so great. All right, everybody, please stick around after the break. I will BRB. Thank you so, so much for being here, Dr. Hendrickson. This
I've
was
really enjoyed it.
fantastic.
Thank you so
Oh,
much for inviting me. I enjoyed it thoroughly.
oh my gosh. Thank you. See you soon, everybody.